Do you ever find yourself in a constant battle to keep your attention where it needs to be? In today's video, we're uncovering the less talked about aspects of ADHD in adult life. From restlessness to time management struggles, let's explore these signs and what they mean for you. Number 1. Understanding ADHD. ADHD, or Attention Deficit Hyperactivity Disorder, is commonly associated with childhood, but many adults carry it into their later years, sometimes undiagnosed. It is a neurodevelopment disorder that affects one's attention, impulse control, and activity levels. In adults, ADHD can manifest differently compared to children and can impact various aspects of life, including work, relationships, and daily activities. While everyone can experience inattentiveness or hyperactivity at times, for adults with ADHD, these behaviors are more severe, frequent, and interfere with their lives. Understanding ADHD in its entirety is pivotal for identifying it and managing it effectively. Number 2. Persistent forgetfulness. One notable sign of ADHD in adults is persistent forgetfulness. And this isn't just occasionally forgetting where you put your keys. Adults with ADHD might miss appointments, forget to pay bills on time, or fail to complete tasks at work or home. This chronic forgetfulness can extend to conversations too, forgetting what was just said, leading to social awkwardness or difficulties. This persistent pattern of forgetfulness, especially if it causes stress or disruptions in various aspects of life, might indicate ADHD. Number 3. Difficulty sustaining attention. Difficulty sustaining attention during tasks, conversations, or reading is another hallmark sign of ADHD in adults. They may become easily distracted by unrelated stimuli, finding it challenging to focus on the ongoing task or discussion, which might be perceived as carelessness or disinterest. This does not pertain to ordinary instances of mind wandering. The intensity, persistence, and disruptive nature of this inattention point towards ADHD. This chronic distraction can create hurdles in the professional and personal realms, making task completion and active listening challenging. Number 4. Hyperfocus. Conversely, hyperfocus is another aspect of ADHD that might seem paradoxical. Adults with ADHD can become so engrossed in an activity that they become oblivious to everything around them. This intense focus makes it difficult to shift attention to other tasks, leading to challenges in social interactions and task management. It's crucial to understand that hyperfocus is not a conscious choice and can lead to the neglect of essential responsibilities. Being aware of this can facilitate better management strategies. Number 5. Impulsivity and restlessness. Adults with ADHD often act without thinking, make quick decisions without considering the consequences, and struggle with sitting still. This impulsivity might manifest as impatience, making abrupt decisions, or frequently interrupting conversations. The restlessness might seem like fidgeting, an inability to engage in quiet activities, or becoming easily bored. This isn't about getting bored every now and again, but denotes a persistent pattern impacting daily functioning and social relations. Number 6. Emotional challenges. Navigating the emotional tides often proves daunting for adults with ADHD. Emotional dysregulation, characterized by mood swings, short-temperedness, and heightened emotions, can present significant challenges in maintaining stable relationships and managing social scenarios. These emotional disturbances are not usual responses to life events, but can emerge without apparent triggers, often leading to misconceptions about an individual's emotional stability. Being aware that emotional challenges in ADHD are not intentional but a part of the neurodevelopment aspect can pave the way for compassion and strategic emotional management. Number 7. Poor time management. Time management is notably tumultuous for adults with ADHD. This involves struggles with being punctual, appropriately estimating the time needed for tasks, and managing tasks within a set time frame. For an adult with ADHD, the concept of time becomes elusive, creating challenges in planning, scheduling, and adhering to set timelines, often impacting work scenarios and their personal life. Implementing structured routines and utilizing time management tools can offer substantial assistance in navigating through this. Number 8. Organizational difficulties. The labyrinth of organizational challenges for adults with ADHD encompasses difficulties in creating and maintaining orderly spaces and structures in their lives. This organization may manifest as cluttered spaces, mismanagement of documents, and erratic planning. But it's pivotal to understand that this is not reflective of laziness or negligence. The brain's executive functions, which are imperative for organizing and planning, are often impacted by ADHD. Assisting adults with ADHD in building organizational skills through tools and supportive structures is vital to alleviating these challenges. Number 9. Relationship struggles. Navigating through relationships can become intricately complex for adults with ADHD. The accumulation of previously discussed signs like impulsivity, emotional challenges, and organizational difficulties often seeps into their interpersonal relationships. Misunderstandings, perceived negligence, and inconsistent behaviors can strain relationships, both platonic and romantic. Hence, ensuring that both parties in a relationship understand ADHD, its manifestations, and collaborative strategies to navigate through its challenges is crucial to maintaining healthy, supportive relationships. Number 10. The neuroscience behind ADHD. To truly grasp the essence of ADHD in adults, delving into the neuroscience behind it becomes pivotal. ADHD is not a result of laziness or a lack of discipline, but is rooted in neurobiological disparities. Studies indicate variations in the brain structure, size, and activity in individuals with ADHD, pointing towards a biological basis for the diverse symptoms witnessed. Particularly, the areas that oversee attention, impulse control, and executive function exhibit variations. Understanding that ADHD is fundamentally linked to neurological aspects underscores the significance of adopting an empathetic and supportive approach towards individuals navigating through it. Number 12. Comorbid conditions. Navigating ADHD often doesn't exist in isolation and can coexist with other mental health conditions, a phenomenon known as comorbidity. Anxiety, depression, and learning disabilities are often interwoven with ADHD, each amplifying the other's intensity. Understanding the intertwining nature of ADHD and comorbid conditions is imperative for accurate diagnosis and effective management. Professionals may implement a holistic approach to managing all existing conditions, ensuring that one doesn't negate the management of the other. This multidimensional approach to understanding and managing ADHD offers a lens through which we can view the complexity of the disorder. Number 13. Strategies to manage ADHD. Managing ADHD often entails an amalgamation of medications, therapies, and skills training. ADHD medications, often stimulants, work by enhancing the activity of certain neurotransmitters in the brain. Coupled with this, cognitive behavioral therapy can offer strategies to manage time, organize tasks, and handle emotions more effectively. Implementing practical strategies like using planners, setting reminders, and creating structured routines can also facilitate smoother navigation through daily tasks. The objective is to curate a personalized strategy, amalgamating various approaches to optimally manage ADHD in adults in diverse life domains. Number 14. Support systems and ADHD. For adults grappling with ADHD, a robust support system becomes an unspoken ally in their journey. A well-informed support system that comprehends the intricacies of ADHD is pivotal. Support groups, either in person or online, can offer a safe space to share experiences and strategies and offer mutual encouragement. Moreover, family, friends, and colleagues can imbue daily life with understanding and accommodation, recognizing the challenges while also acknowledging the strengths that an individual with ADHD brings to many areas of life. Number 15. Embracing ADHD. It's imperative to discuss acceptance and self-compassion. Adults with ADHD might grapple with self-doubt and perceive failures, shadowing their numerous strengths and uniqueness. It's pivotal to understand that while ADHD brings challenges, it also bestows unique perspectives and attributes. Creativity, the ability to think outside the box, and often an unparalleled zeal for passions are among the gifts that ADHD can provide. Number 16. ADHD and career choices. Carving a career path while managing ADHD can seem like a daunting journey. However, with the right strategies and understanding of one's strengths and challenges, it's eminently navigable. Adults with ADHD often flourish in careers that align with their passions, offering a blend of structure and creative freedom. Engaging in careers that resonate with one's intrinsic motivations can transform the often misunderstood challenges of ADHD into powerful drivers of innovation and dedication. Number 17. Advancements in ADHD research. Keeping abreast of advancements in ADHD research enriches our understanding and management of the condition. From exploring the genetic components that might predispose individuals to ADHD, to innovative management strategies and therapies, ongoing research continually shapes our perceptions and approaches to ADHD. Research in neuroimaging, medication, behavioral therapies, and neurofeedback continues to evolve, offering hope for more tailored and effective management strategies in the future. As we navigate through existing knowledge, embracing new findings ensures that our approaches to managing ADHD remain progressive, empathetic, and scientifically grounded. The role of nutrition in managing ADHD. The nuances of managing ADHD extend into the realm of nutrition, wherein what one consumes can play a tangible role in managing symptoms. Some studies suggest a correlation between dietary habits and the intensity of ADHD symptoms. Implementing a well-balanced diet rich in fruits, Vegetables, lean proteins, and whole grains can bolster overall health and potentially assist in mitigating some ADHD symptoms. Moreover, while the notion of a direct link between sugar and hyperactivity is widely debated, ensuring a stable blood sugar level through consistent, nutritious meals can be a beneficial strategy. Number 19. Society's perception of ADHD. To address society's perception of ADHD, it's pivotal to acknowledge the prevailing myths and stereotypes that permeate through collective understanding. ADHD is often misinterpreted as a lack of discipline, a refusal to conform, or simply being hyperactive. Educating society, advocating for accurate representation, and fostering a community that understands and supports neurodiversity becomes imperative. Changing societal perceptions involves dismantling stigmatized narratives and fostering an environment that acknowledges and supports diverse neurotypicalities, ensuring that individuals with ADHD can navigate through life without the burden of misconceptions and judgments. Number 20. Seeking professional help. Acknowledging the multifaceted challenges that adults with ADHD navigate through is the first step towards alleviation. However, it is imperative to emphasize that recognizing signs is not tantamount to a diagnosis. Professional help through psychologists, psychiatrists, and specialized coaches is pivotal in confirming a diagnosis of ADHD. Once diagnosed, professionals can guide patients through a tailor-made management plan which might involve therapy, coaching, and possibly medication. Navigating through the intricate web of ADHD without professional guidance can be perplexing and ineffective. Encourage reaching out, as understanding, managing, and thriving with ADHD is eminently possible with the right support and strategies. Having explored these signs of ADHD, are you ready for more insights? Watch 12 Signs You're a Hidden Genius Among Ordinary People, or delve into 13 Strategies of Highly Productive People. Thank you for watching. Please like, comment, and subscribe.